Hey everybody, Martin here with Tree of Light Health. Hope you guys are having a great spring. The weather has been amazing. Hope you've been enjoying that. Um, May is Lyme Disease Awareness Month, and so of course we want to generate awareness on this very important condition that is affecting you or potentially affecting you and your family. So please be careful of all those tiny little smaller ticks out there called nymphs. One little innocent bite like that could lead to a lifelong problems for some of you that are susceptible. So we want to get into a little bit today on how or why Lyme is so hard to diagnose and why some of these weird symptoms that you might be experiencing, the brain fog, fatigue, the joint pain, the anxiety may not be in your head. You're definitely not crazy. We see these every week in our clinic. And so we're just trying to create some awareness of that. We're going to do two parts in our talk today. This is just kind of going over sort of a general overview of Lyme and some of the testing that's involved. And then really in part two, we'll go over in more with how we treat this condition, okay? Um, so it is more and more awareness now about Lyme, okay? It was once really dismissed. It still kind of is in mainstream medical, but there's some awareness creeping in with the new administration and with the advent of some of the documentary films out there, such as Under Our Skin, which you should check out if you haven't done that already. Um, but yes, these days, vector-borne illness is finally gaining some recognition as a potential problem. But on a good day, all mainstream medicine really recognizes is acute Lyme, not post-treatment or chronic forms of Lyme. That's very controversial and is dismissed depending on what part of the country you're in. When I was in family medicine, all we really were trained to do is maybe give a little antibiotic for maybe a week, 10 days, 2 weeks tops, doxycycline. And as we all know, that may not get to the heart of the problem given how sophisticated these bugs are. Um, so just some important disclaimers. None of this is for medical advice. This is just for educational purposes only. A lot of the things that I'm going to talk today about have not reached FDA approval. Some of the medications we use are off-label and are not considered standard of care for Lyme. And then, of course, some of the more advanced things we do are not considered mainstream medical, like Ibu ozone, Q restraint, SOT, Ibu ozone. Okay. The cases of Lyme are on the rise. Over 500,000 cases a year, and about 50% of those go on to develop some form of chronic symptoms. Now, let me just break that down. There's a spectrum of problems with Lyme. Okay, you can just have a small nagging problem like an aching knee or maybe some anxiety or insomnia, and then there's the spectrum where you can have many worse symptoms, right? Just really debilitating symptoms that we do see here. So we see a spectrum of problems with chronic Lyme. Okay, not there's not one classic picture for chronic Lyme. And then, given some of the complexities that we see with the diagnostics or lack thereof, it can take some years to get diagnosed properly with Lyme. Okay. These are ancient bugs, guys. They have been with us for millennia. There is a story of this mummy that they found in the Italian Alps. Some hikers were out there and they ran across a mummy buried in the glacier there. Otzi the Iceman, he's about carbon dated over 5,000 years old. And he was riddled with spirochetes. Okay, so the DNA testing that was done showed a lot of Lyme in him, but he was otherwise healthy. He was in his mid 40s, which was ripe old age for that day and time. And he had food in his stomach. He was a hunter. He had some tattoos, but he suffered from an arrow blow or an arrow wound. Okay, so he was killed by blunt trauma. So, but not necessarily Lyme. But so what has changed? If these bugs have been in our system for so many thousands of years, why are we seeing it now coming up to be a problem? And we're detecting it in a lot of people. Well, we think part of the problem is that all these toxins that we're exposed to on a daily basis, 80,000 of them, in fact, are really causing problems for our bodies, right? They just slow our detox pathways down. They stress our physiology out. And that leads to just this chronic unrelenting stress, not to mention our stress from our job and kids and all of the geopolitical things that are going on. Nutritional deficiencies are rampant. We don't hardly ever see anyone with normal vitamin or mineral levels. Folate deficiencies are rampant. And then, of course, diet. We're all busy and rushed and don't have time to prepare meals and eat too much sugar and too much caffeine and things like that, and those weaken the immune system. Our circadian rhythms are off. We're not living in natural environments. We're supposed to be outside, but we spend all the time inside looking at blue light devices, and that weakens the immune system. Mold is a big one, which we'll talk about later. And then post-COVID, really since COVID time, there's really been a lot of immune dysregulation in the system. Skipping back there, let's go to this one. Okay, so Lyme is not just transmitted by ticks. I hope you guys know that. It's really a misconception that these bugs are just harbored within ticks. No, they're within any type of insect. And those insects can be vectors for Lyme disease. So that includes spiders, mosquitoes. I saw a terrible case of a person with Lyme disease that got bitten by sand fleas, okay? All of those things carry disease. Sexual transmission, even in utero, okay? But that's not necessarily recognized by mainstream medical, but that's how, we see patients that come to see us, okay? That, many of them never have had the classic bullseye rash, right? From, the classic bullseye rash. I would say maybe 5 or 10% of our patients have had that in the past, but the majority don't. And not only that, they may not even have a history of any tick bite. So that's even a little bit more complicated, and we'll talk about that. So could it be Lyme, right? So all the joint pain, the swelling, anytime you have a migrating joint pain, that really raises suspicion for Lyme disease. If it shifts, say, in the knee in the morning, and then it's in the shoulder by the night, or one day the left knee and then the next day the right, we start to raise our suspicion for Lyme. Chronic fatigue, right? So let's say we clean up and detox really well. We're working on nutrition, our sleep, our stress, and we're still having chronic fatigue, then that's something's off, right? We need to look at a little deeper of why that is. Anxiety, panic, depression. Let's say you got a tick bite, you found a tick on you last year, and then all of a sudden, you start experiencing anxiety and panic and insomnia. That could be Lyme disease, right? So we need to think about these things. Brain fog, memory issues are pretty common with Lyme. Insomnia for sure. Trouble falling asleep, especially. These act as parasites, and they kind of interfere with us sleeping at night. The neuropathy, tingling, that may not just be a diabetes thing or some other neuropathy. What about Lyme? Heart palpitations, POTS, or postural orthostatic tachycardia syndrome. We see that a lot with this autonomic dysregulation, which Lyme seems to affect is the autonomic nervous system. That's your digestion, right? That's your heart. That's all the things that normally your body would control and regulate. It can't do that when you're dealing with chronic Lyme. Weird things like floaters, blurred vision, other types of neurological symptoms like zingers. One thing that we found is Lyme can really hide out in the bones and joints and the central nervous system. We detect that with a technique called autonomic response testing. Okay, so that's an advanced biofeedback test. And again, Lyme doesn't really live in the blood. Technically, it lives in the joints and in the nervous tissue and is deep in the organs. It wants to hide from the immune system. Some of the 3 bad actors here that we talk about with Lyme, and all of you are probably aware of, is Borrelia, Bartonella, and Babesia. Borrelia is just the spirochetes, the Borrelia burgdorferi and its relatives. And this causes the classic joint pain, neurological symptoms, and they're just stealth, invasive, they form biofilm, so they're not nice actors. Bartonella, traditionally from cat scratch, but we see Bartonella patients never had a history of cat scratch. Okay, so it's a bit of a head scratcher, but this can cause anxiety, rage especially. Rage and anger with Bartonella is very common. Foot pain, sort of like plantar fasciitis type, mystery plantar fasciitis. Striae-like skin lesions that we see, almost like the stretch marks. Those cause. We see that with Bartonella. Babesia causes a lot of air hunger and night sweats. This is more of a malarian-like protozoan that can lay down fiber nests, okay, and live in sort of these nests in your vasculature. So that's because the lungs are very vascular, that's one reason that we see Babesia. And then, of course, there's all these other unfriendly things that hang out in the system of these ticks. And that can include things like mycoplasma, rickettsia, different viruses, different parasites, okay? So when I was researching this, I thought that, one tick bite would have many of these things. That's actually not true. A tick bite usually may not have any of it, but it can have 1 to 2 to maybe 3 pathogens in it. But the many pathogens that we see, a lot of times, it's kind of hard to say. That could be from multiple tick bites. That could come from mosquitoes, that show up in the blood. But then the other thought process is that in certain regions of the country, there's higher pathogen counts with the ticks that they test, okay? And typically up north, we're going to see more of that. But the bottom line is that when you get a tick bite, you're at risk for many different things, okay? Or an insect bite. Lyme can trigger autoimmune disease. So one thing that we may not realize is that the immune system is very sophisticated and it's surveilling the entire system at all times, okay? And if it detects a problem within a cell, let's say you've got some Babesia living inside, say, red blood cell, the immune system will try to attack that, right, and cause inflammation. But what if it's in your joints, or what if it's in your, that's rheumatoid arthritis. The body will inappropriately attack your joint tissue. Will your rheumatologist ever kind of get that concept? Maybe not. We hope they learn about Lyme, but for sure, that could be the reason for your rheumatoid. What about psoriatic arthritis? We've got a patient here with, a rather challenging case of psoriatic arthritis. Again, attacking the skin, creating psoriasis-like lesions, attacking the joints, causing joint pain. And then, all of the other types of autoimmune conditions that we see, we suspect that Lyme could be implicated in that. So we'll get into some of the diagnostics here in a minute, but we quickly determine if a patient has got Lyme and some of these co-infections with something called low-dose immunotherapy, right? So if we give a patient something called Lyme LDI and they improve, okay, their joint pain goes away and their insomnia goes away, or they feel better, well, that's kind of diagnostic that, boy, you could have some Lyme going on, or you get worse. Say you get a detox or Herx reaction. So I'm a prime example, just so you know. I'm a very mild Lyme case. I grew up in Virginia, had ticks on me. We had dogs. We had 30 acres of soybean. I lived on a farm, and it was just part of our life. And sure, I had ticks on me when I was a kid. And so here I am many decades later, and joints hurting a little bit, waking up in the night. So I detected this in myself and, gave myself an LDI, and sure enough, joint pain goes away and sleeping better through the night. Okay. And then, of course, it shows up on the testing. Okay. So again, we can use very simple methods. It does not have to be expensive. LDI, guys, is $30. All right. It's not a huge thing, but we do this here in the clinic. And then, of course, herbals, right? If we give certain targeted herbals, such as Byron White's Ale Complex for Lyme, and we get a detox reaction in you, that could mean that you've got Lyme there, and that's a major part of your symptom picture, right? Or if you feel remarkably better, right? These are some of the little tricks that we've worked out over the years, and of course, there's many more tricks. Okay, and I apologize, I have skipped ahead of my slides here a little bit, so let me jump ahead. And I want to mention that there's an Alzheimer's connection with Lyme. Okay, so we think Alzheimer's is just kind of old aging, the brain getting older, but no. Dr. Alan McDonald had discovered these spirochetes in the brain, and this leads to some of us wondering, well, how much of Alzheimer's, or what percentage of Alzheimer's could be Lyme disease? And a lot of his autopsies that he did of human brain, he found spirochetes there. So that's very interesting. Okay. The neurological disease, so we certainly see our fair share of Parkinson's and multiple sclerosis and Lou Gehrig's patients here. And I must say, we have found Lyme in a lot of these patients. Okay, again, there's an autoimmune component to these, most definitely with multiple sclerosis, but I suspect with Parkinson's and ALS as well. And again, as Lyme is hiding in the central nervous system, the body goes on attack mode and creates a lot of inflammation and destruction of these motor neurons in the case of Lou Gehrig's, or the substantia nigra in Parkinson's. Now, if you yourself or know anybody who has ALS, please be aware that Dr. Lee Cowden is one of my colleagues, and he's retired now, but he has headed up an healing ALS group, and he came up with 47 steps for helping to overcome or heal ALS. And so do check that out, okay? Some of the testing, okay, and I'm sorry if I'm jumping around a lot, but I just want to make you aware that, if you think you can get a full workup by your primary care physician or even infectious disease, don't get your hopes up, okay? The standard testing is pretty miserable. Why is that? The ELISA and the Western blot, really requires a strong immune response, and Lyme suppresses that immune response. And so if you don't have a strong immune response, it's not going to show up on the test. But not only that, it doesn't have many bands that it looks for. So there's about 10 bands there, and 3 for the IgMs, okay? And the CDC criteria is, a positive on so many of the IgG bands and so many of the IgM bands. And if those aren't positive, then you're not positive for Lyme disease. So it often comes back negative, essentially, okay? PCR testing, I find that a lot of that testing rarely shows positives in the blood. And then there is an indirect test that is pretty good, I guess. It's covered by LabCorp, CD57, and natural cell killer count. So if that is low, then something's affecting your nervous system. It's not directly diagnostic for Lyme, but it's a good kind of indirect, marker for that. Some of the more advanced testing options, I'll jump maybe right to the most popular one, which is the IGeneX Immune Blot. That one's very well known at ILADS. And by the way, I'm a member of ILADS. That's the International Lyme Association. And so for practitioners, we get together every year and we talk with these labs and go over all the research. So if you're a practitioner or a patient and haven't had a chance to go to an ILADS meeting, I'd strongly recommend that. Very, very informational. But anyway, IGeneX really expands the CDC bands, okay, for Lyme disease. So if there are, for example, with the CDC standard 13, the combination, 3 IgMs and 10 IgGs, then IGeneX has 57, right? So it looks for way more things than the CDC does, okay? So yeah, 44 additional class-specific bands, okay? The other one that's popular these days is the Vibrant Tick-Borne 2.0 test, okay? And that one covers just many more pathogens, okay? 16 Lyme group strains versus 9. It adds 2 extra Bartonella antigens, and then it has a really great opportunistic viral panel to look for, the strange viruses that we feel are implicated in Lyme disease, such as the Powassan virus, West Nile, okay, Mycoplasma, Chlamydia, pneumonia, CMV, Epstein-Barr, all of the herpes viruses, and paravirus B19. By the way, paravirus B19, I see is a real problem with a lot of our Lyme patients. And what is that? That's the slapped cheeks or fizz disease that, we all have as children. So we all have positive IgGs for that, like we have positive IgGs in our blood for Epstein-Barr. It doesn't mean it's active. But again, I think my theory is that the body has really had to pay attention to these viruses throughout our lives. And as the stressors pile on, work, life, stress, COVID, whatever, then any kind of dormant Lyme can come out and play. So we treat viruses a lot with our Lyme patients. We feel like that's very helpful. And I'll talk to you about retroviruses in the next slide or next few slides. Lyme is profoundly evasive. I mean, do you think that a sophisticated bug like Lyme disease that's been around for tens of thousands, if not millions of years, can just say, okay, well, you got me, I'm dead, if you give it an antibiotic or an herb. And unfortunately, it just doesn't work like that. It hides inside the cells. It hides in the connective tissues. It hides under biofilms. These are the slime coat layers that the Lyme bugs produce to evade the immune system. And they live in sort of colonies and films in the blood vessels and in the joints and tissues and in the central nervous system. It also changes form, so that means they're pleomorphic, so it can go from the cell wall form to the the spirochete form to the cyst form to the L form to these little cyst type forms, and boy, it just it can go dormant for years, okay, and evade the antibiotics. In fact, it can change its shape. Say it senses the antibiotics coming through, different mechanisms that it uses. It can go into hiding into a cyst form and be very difficult to treat. Okay. So each form requires different treatment. That's typically why it's not just one antibiotic you would need or one herbal. You need multiple to get to all the different stages of the life cycle and all the different forms of Lyme. Also, it silences immunity. We'll talk to you more about something called KPU or Cryptopyloria here in a minute. There's a lot of symptom overlap with Lyme disease. Lyme and mold and Epstein-Barr and post-COVID really share a similar symptom profile. And boy, does this lead to a lot of frustration with practitioners and patients alike. And it's really stressful for everybody. So again, this is, and it's very costly, right? You see some of the cost of the testing, T-Lab, it could be as much as $2,800. So how do we get to this? How do we sort of assess these things out? And so years ago, we started working with Dr. Klinghardt and learned his methods, and really it was beneficial to help us identify in a patient visit. We can always look at questionnaires, right? By the way, if you got Lyme disease, check out the Dr. Horowitz questionnaire. We'll send that to you. If you're scoring about 35 or 40 and above, boy, you might be dealing with a chronic vector-borne problem, okay? But anyway, autonomic response technique, we use different tools and techniques here to see if your system is stressed by these bugs. And then not only that, which bugs are a priority for you, or which types of issues are a priority for you. And if you have mold, should we prioritize that? Or Lyme, should we prioritize that? Okay, so these are very helpful diagnostic tools that we have. But again, there's a lot of confusion. There's a lot of overlap just between mold and Lyme, right? And that creates a lot of confusion for a lot of people. One way to kind of get around that is a test that is from my colleague, Dr. Bruce Patterson, who I met at iLabs a few years back, and he came up with a test that looks at cytokine, actually. So he used artificial intelligence to figure out, okay, do you have a cell messenger system? Cytokines are cell messengers like interleukin-2 or TNF-alpha. Do you have a pattern of those cytokines that fit more the mold picture or more the Lyme picture or more the COVID picture or all of the above? And so he's got a real sophisticated way to determine that. And we've seen some value with that with some of our patients. And it also is very validating to the patient, but again, more of an indirect test, but it can guide treatment. So that's, very helpful. This is just more information on how to interpret those cytokine panels. I just thought I'd throw this up, for some of you who've been down the road and are still, curious whether you're dealing with mold or Lyme. This is a great test to run, and if you want to do something in addition to what we do, here in the clinic. Notice that CCL5 is one of the cell receptors or cell messengers that is implicated in long COVID, and when that is active, that can create a lot of endothelial inflammation, okay, blood vessel inflammation, and also pain. So what Dr. Patterson figured out is that he can block that receptor, and he found a drug called Moraviric, which is actually an HIV drug, but we use it off-label to block this receptor to then reduce the pain symptoms, right? Some of you with chronic Lyme have terrible pain symptoms, and it's just very hard to treat. So we have seen some success with Moraviric. The problem is it's a little expensive, it's not covered by insurance, so we have to take that into account. But I just wanted to introduce you guys to that test. It's by Radiance Diagnostics. So ask us about that if you're interested, okay? So here's something a little controversial, and I know I might ruffle a few feathers here, but I do get a lot of patients, that have been treated by other practitioners and things like that. And, we're all trying our best to get the patient better. And, yes, if you see a positive IgG on a lab test and you have the symptoms that, again, we're overlapping with mold a lot with symptomology, the practitioner would put them on antibiotics, and sometimes for a very long time. And that can have a lot of negative effects. It can screw up the gut health, create yeast overgrowth. It can weaken the immune system. But actually, in our practice, we see about 90% of our patients have mold as a priority issue for them, rather than Lyme. They may have a little bit of Lyme, okay, but it's the mold that is in there that really stresses the immune system and is causing problems for the patient. Mold really weakens that immune system over time. It suppresses immune surveillance. It disrupts the detoxification. It allows pathogens like Lyme to persist. So if we don't address mold first, or at least alongside with the Lyme in this patient, then they're not going to get better. In fact, when I used to work with liver transplant at Emory, the drug manufacturers came up with a drug called Cellcept, and they learned from the mold world that there's a mycotoxin called mycophenolic acid, which is a potent immune suppressor. So we see a lot of that mycophenolic acid come up in you guys who are struggling with these things. And if it's present, boy, is that weakening the immune system, just like the drug Cellcept that we use to keep the patient from rejecting the liver, right? So this is something to really, really contemplate, right? So we actually use multiple ways to test for mold in our practice. I know that some of the urine testing is popular out there. And of course, we also look at CIRS, or chronic inflammatory response syndrome. That's more indirect testing for mold and biotoxins. But we do like a serum test here where we can see, are you colonized for mold, for example? Are you breathing in these mold spores, or had you breathed them in the past and they're creating mycotoxins in your system to this day? And then are you potentially getting exposed? And usually that's the problem, is we're still getting exposed to molds. And this is why, it's weakening the immune system, and Lyme is persisting. So again, I just wanted to, maybe mention that, okay? Now, that's not to say that there is 10% of you out there that, yes, in fact, when you got that tick bite, all hell broke loose and all your symptoms came about. And for sure, we have those patients too. I would say that's probably more popular up north, but yes, that would mean you're going to fit more in the Lyme priority category. Okay. Now, really, since COVID, it's been very challenging, guys. As you probably know, prior to COVID, we could give some antibiotics, we could do some double dapsone treatment, and get the Lyme under control. But these days, things are much more challenging. And if it was, the Lyme can resurface because the immune system is trying to deal with the immune insult from this new thing that our immune systems have never seen before, right? And so we all of a sudden started seeing Bartonella show up on Lyme panels, and Lyme, of course, and Babesia, and all of these things. Also Epstein-Barr, okay? So I always say COVID came in and kind of scrambled the hard drive. And it's not unusual for us to see all three, major things. We see a patient that has mold, also Lyme, also COVID, right? And so how to identify and prioritize all that, that's what we've sort of worked on here over the years. Here's another controversial topic, and sorry to throw all of this at you, is that, the question is, well, do we all have Lyme? And the reason I bring this up is if I look hard enough, okay, say in the patient or in my system, I might find a little bit of Lyme there. But usually in a healthy person, the immune system keeps it at bay, okay? Such as my case, I'm healthy. I run, trail marathons and things like that. And otherwise doing pretty good. But I have a few nagging issues, right? And we detected Lyme in my system and we treated appropriately. But yes, when we run like a test like Vibrant, for example, we see, gosh, I think every Vibrant test I've ever run has showed a positive IgG at least, and some IgMs for Lyme. And the patient may or may not fall on the severe symptomatic spectrum, on the symptom spectrum. But sure enough, it's there. And then, of course, we do advanced kind of bioenergetic testing with meridian stress analysis and craniobiotic technique and autonomic response technique and field control therapy. We kind of find a little bit of Lyme in just about everybody. But that doesn't mean that you are sick with it, okay? That's what you have to understand. You got to understand this, is that Lyme is a problem of the immune system, right? If you have a fully functional, intact immune system, Lyme should not be a problem for you. And if you are dealing with Lyme symptoms, it means we've got to work on that immune system, right? It's not to make it over simple, especially for those of y'all who've been dealing with this for a long time. And I know it's frustrating, but really, it's when we use technologies such as TrueDose PRP to improve the immune system, boy, do we see some great breakthroughs, right? And again, why do we have this kind of low grade burden? We think it's the molds and some of the post COVID exposure. Also think about aging, right? We see these Lyme cases kind of increase with aging, and we see autoimmune disease increase with aging. Of course, memory decline and things like that with aging. We think it could be the weakening of the immune system. I'm not sure if you guys realize this, but there's a thing called Th1, Th2 dominance, right? And we have an article on the website about that. But anyway, as we get older, the immune system shifts to Th2 dominant. So we have less of that Th1 hardy, go get them, innate attack and kill immune system. And so things can kind of sneak in and cause problems for us. So we got to really strengthen that Th1 or just at least balance the Th1 and Th2. So we're not so Th2 dominant. And then one thing I'd just like to mention is, chronic emotional stuff, or at least the history of, a lot of our patients have a history of PTSD or emotional trauma. And, the immune system is like this. If our stress is high, our immune system is low. And how many of us, gosh, divorce or loss of job or loss of loved one, and then all of a sudden we end up with a chronic health problem. It may or may not be Lyme disease, but it's because that immune system took the hit. So again, it all comes back to the immune system, and we've really got some innovative ways to support that. One thing I'd like to mention is retroviral stress. This came up, maybe 4 or 5 years ago with Dr. Klinghardt, and he was working with Dr. Judy Mikovits and found that if he treats these retroviruses, then a patient gets better from Lyme. So first of all, what are retroviruses? These are integrated into our DNA. They don't show up on standard LAMP panels. If you think viruses are hard to detect, retroviruses really are. We detect them indirectly through lab markers like RANKES or CCL5, which goes up when retroviruses are active. Interesting, when we block CCL5, the patient gets better. Isn't that interesting? Okay. But anyway, Dr. Klinghart's observation, as well as mine, is that, boy, when we're able to treat these retroviruses and keep them from becoming active, then we're able to get the Lyme patient better without using aggressive antimicrobials, which of course have side effects. So again, I actually see a lot of improvement with our patients when we treat the viral component, the Epstein-Barr's, the paravirus B19s, the herpes viruses, all of that. And then the body's immune system can recover a little bit, and then we can gently go after the Lyme using some of our techniques. Just some quick retroviral supports here on the right. I won't get too much into it, but yes, we do like Cistus T from the Sardinia region. Very hardy bush that kills the biofilm, kills the Lyme, does many great things in the body. Retro V powder from Key Science, and then broccoli sprouts. Okay. So why do antibiotics often fail in chronic Lyme? That's an important thing to question, right? Or if when the antibiotics are stopped, then the patient gets worse. Okay. But let's start with the antibiotics. So first of all, obviously these things are changing form, and if you don't use that perfect array of antibiotics to get to the treatments, it won't be able to kill the Lyme. The biofilms really block the penetration of the antibiotics and antifungals. Okay, so again, these biofilms have really gotten severe since COVID time. We're actually working with a researcher right now. She uses an electron microscope, and she found these like man-made types of material, hydrogels, she calls them, that actually make the biofilms that used to be kind of able to treat, with things like serrapeptidase and, other types of things, nattokinase. Now they're like, you can't even get into them. So whatever was this stuff is creates a hard polymer shell, and then we can't penetrate it. It's hard to treat, and we drive ourselves nuts doing that. Now we have some innovative things here. Some of you guys might be taking things like the monolorins. Okay, we have a liposomal version of that called aqualorin. It's quite nice to get to it, but even that is not as effective anymore. So we have some other things up our sleeve that we're trying, and that seems to be helping. But again, it's one of the reasons why patients not getting better. Again, mold, antibiotics treat mold, treat bacteria, not fungus. So we've got to address the mold layer. Okay, doesn't touch the retroviruses. There's no way that antibiotics can do that. It doesn't touch the parasites. You guys, parasites are a big issue with Lyme disease. Okay, interestingly, the big guys tend to eat the smaller guys. So picture a big parasite up here eating the bacteria, okay, and then the bacteria is eating the viruses. So if you take out the big guy, you're taking out the bacteria and the virus. All right, so that's why a lot of Lyme patients respond well to the anti-parasitic protocols, say from Dr. Simon Yu, who we're a big fan of. But again, everybody's different, okay? And you have to be careful when you use antiparasitics, because then that kills the bugs, and then they release the toxins, and the patient can have a detox reaction. Okay, Bartonella and Babesia are often missed. For sure we see that. We're very Lyme focused within our community, but we forget that Bartonella and Babesia are just as bad. And we do have some really great innovative technologies, such as difenaquine and things like that for Babesia. And we'll get more into that in the second part of what we're going to talk about. And then I want to just mention or remind you guys of Cryptopyloria. What happens is that Lyme infection drives the production of these things called pyrroles. And then those pyrroles bind to the zinc and B6 in our system and release them out of the urine. So essentially we get low B6 and zinc over time, and the patient gets depleted. Remember, B6 and zinc are critical for neurological function, right? So this is how our dopamine is made. This is how our serotonin is made. So it's almost as if Lyme and these bugs really make us depressed and lack of motivation, right? They don't want to kill us. They don't have like a virulence rate of, say, like an Ebola or nothing, but they have a low grade virulence to just keep us very weak, okay? And the way they do this is with Cryptopyloria. And then the symptoms snowball, the anxiety, the insomnia, because everything is run, including the immune system, on zinc and B6. B6 is very important for pain regulation, especially with nervous system, right? So we detect these in the urine. We run a urine pyrrole test, and then we also cross-reference that with our autonomic response technique or biofeedback. And then once we support the B6 and zinc in the system, we maybe track that with a few technologies like OligoScan and other things, then the patient tends to improve, okay? And again, it comes back to that terrain theory. If we improve the strength of the host, and which is you, and we reduce the bugs in the system, the patient gets better. Can we ever fully eradicate Lyme? Well, that's another very controversial topic. I would say probably not. But what we can do is reduce the bugs. Okay, we can, we use certain technologies here for that, and then we strengthen the terrain, as I mentioned, and then eventually the immune system can hold it in check, right? I just want to give you guys a little bit of maybe a few anecdotes. Okay, so we had a patient very sick with Lyme, had to be on disability, and which was really discouraging for her, and a lot of pain symptoms, a lot of pain in her joints and especially her hands, and it was very debilitating for her. And anyway, we identified the Lyme. We actually did not run a whole lot of advanced testing, but we used our automatic response testing, and we used things like LDI, or low dose immunotherapy, and herbals and things like that to really calm that system down. And then she really started to see improvement. And then we reset her immune system with true dose BRP. True dose BRP is when we take some blood out of you, we concentrate that down, we run it through a computer system that really gets the dose right. Apparently, or what we've come to learn is that the dose has to be exactly right of the platelets. And this is systemic platelets. This isn't like platelets you inject in the joint. And it just fixes, it just supports the immune system because platelets are antimicrobial and they help to coordinate the entire immune system. So anyway, after a series of true doses, she was able to get better, go back to work. She was fully at work for like a year and a half. Then we discovered some mold, okay, and she ended up, that was also why her immune system was weak, moved out of the mold and got a lot better. Then got a little attack from a virus, and I think COVID, and that whacked her immune system down. So she came back to us, and we knew exactly what to do, and we had a much more refined treatment at that point, and got her system back on track. And she'll probably get another true dose for us from us just to kind of reset that immune system. But no, this stuff is very treatable, guys. Don't get discouraged that I'll have Lyme for life and my life is going to be miserable. No, there's definitely things you can do, and we certainly don't want you to have to come and rely on us for the rest of your life. You can take certain herbs and do certain things to keep your immune system healthy, right? I would just want to really hit the point home that you are not crazy, right? These symptoms that you have are real. It's not just getting old, okay? It's definitely, if you haven't looked at Lyme, especially if you have autoimmune disease or some of these other conditions, neurological conditions, please look into Lyme. It could be a problem for you. The standard test is miss it, right? Don't expect your PCP or internist or your specialist to discover it. You really need functional medicine. This is where functional medicine, integrated medicine really shines. Really think about the terrain, think about mold in your system, stress that you're under, and how these can tip the balance in your immune system. And again, just recovery is possible, right? We see it every day here at the clinic. Okay, and then I just want to mention in part 2 here that we're going to talk about all kinds of things on how we kind of help a patient recover from chronic Lyme. I forgot to mention one of the first things here that we do, which is regulation of the limbic system, okay? That's our ancient fight or flight system, and Lyme really does put that on edge. So, again, DNRS, primal trust, Christian brain rewire, please invest in those things. Those are things that you can do at home and feel empowered by. So I'd really encourage that. But, unfortunately, even that is a problem for folks. So we introduced a system called IASIS, microcurrent biofeedback, and that really helps to rebalance the brain, okay? Get that sense of calm in the system. And we really found that that's an important first step. Otherwise, nothing else will work. But anyway, when you come and see us here, we'll talk to you about some testing, right? We'll do the Horowitz questionnaire. We'll introduce you to advanced biofeedback testing if you haven't heard of that already. And if you're open to it, we can kind of give you our thoughts on what your body's dealing with and how to prioritize that. And then we want to stabilize the drain, open the drainage, treat the mold, of course, if it's there, treat the biofilms at the right time, okay? Because if you treat them too early, you're going to have a detox reaction because, that can release some toxins in the system. We want to target the right infections at the right time. Consider advanced therapies like Q-restrained SOT, right, that we'll talk to you some more about in the next section. Moraviric, Trudose PRP, advanced ozone therapy like Ebu ozone therapy, and then we just kind of put it all together and see how it goes from there. Okay, so that's kind of how it is, and we'll go over, of course, all that more detail in part 2. So listen, if you've been suffering and not getting any answers, if you've been told that your labs are normal and, you're not well, if you've been told that it's all in your head, please reach out to us. Okay. Don't suffer alone. And we do offer a 15-minute consultation where we can talk about your symptoms, your history, and whether or not the kind of work we might do can help you. You can visit us at www.treeoflighthealth.com. And we're located in Atlanta at 285 List Road, and we see patients all over the Southeast and beyond. A lot of folks sometimes need to see us for a few days to a few weeks, and they can camp out right next to us here in some of the local hotels that are here. So if you've been suffering, you're not crazy. We believe you. You won't be. You will be heard here, and we can help. Okay. So thanks for joining me on part one of this discussion. Okay. I really look forward to seeing you in part two, where we can go over some of the roadmaps for treatment and some more cases that we work with. In the meantime, do check out these sources for further reading. The CDC, some of their information. Horowitz, Why Can't I Get Better? Okay, and very important book that goes over a lot of his treatments. And Under Our Skin documentary, as I mentioned, patient stories of dismissal and chronic Lyme. Dr. Klinghardt, right? Check him out at Klinghardt Institute. We have some videos and articles about ART, or autonomic response technique, and 5 levels of healing on our website. Very important concepts to understand. Long COVID, immune dysregulation, Dr. Bruce Patterson, Radiance Diagnostics, Long Hauler Index, check that out. Dr. Alan McDonald with his, Alzheimer's research. And then some of the advanced testing that I mentioned, T-Lab, Red Lab, Infecto Lab, Vibrant, all of these advanced labs are very helpful. And I just wanted to thank you guys for hanging with me today. I know that was a lot. Sorry I have to talk so fast. We're here for you. And, if you have any questions about any of what I mentioned here, please feel free to reach out. Again, we'll, see what we can do for you. Okay. Anyway, thanks again. And we'll be in touch, and be well. And we'll check you out on the next one. Take care.